you for taking time and having that interest, about health insurance issues and wanting to use your far-reaching platform to echo some of its benefits to the benefit of the general public. It is a delight and we are grateful. Yes, so just like you rightly quoted, health insurance since its establishment in 2003, the effort of the authority has been to be better by the day. So we find out that we started with booklets that we're offering as identity cards. We moved from there to magnetic cards. We've moved from there to biometric cards. And the improvement is daily. Gone are the days when you used to see in our district offices people sleeping there in days just to get the opportunity to renew or get to register onto the policy. And all those innovations is geared towards serving our subscribers better, serving the Ghanaian people better. And so yes, after we have implemented the mobile renewal, somewhere in 2020, 2021, thereabout, the idea was, okay, now we've initiated that, we've implemented that, it was working well, people were now comfortable renewing and getting active on the system. But how then can we bring a platform that almost harmonizes all the things that we do? You can register, you can renew, you can even register people on board, you can have access to the medicine list that we agree with the health providers in their respective facilities, and other information that you need to be abreast with as far as our services are concerned. And that was what the authority thought right and innovatively brought the MyNHIS app. So in a snapshot, the MyNHIS app is a platform that allows one that has a Ghana card to register himself. So you may not come to the office here for us to take you through the process of registering you. You can do the registration yourself using your Ghana card. Now the question is that people will question, how do I get the health insurance card? No, you don't need the health insurance card. All you need is to be able to register, and technically you have integrated your health insurance details with that of the Ghana card detail, which is almost the mother of all cards now in the country. And apart from that, you can also register people. So I have the platform, I have the MyNHIS app. If you don't have health insurance, but you have a Ghana card, I can use the MyNHIS app to be able to register you on the platform. As I said, if you go to the platform, we have the medicine list. Every year, we agree on the medicines that the facilities are going to be working with. We agree on the tariffs, and we are talking about the tariff, we're talking about the cost components of that tariff. And then once we agree, that becomes the working document. So when you go to almost all the facilities that are signed on to National Health Insurance, they will have our approved medicine list for 2023. 2024, we are going to find them again, go through the renegotiation and say, let's adjust the tariffs higher or lower, whatever it is. But it is an agreement that brings mutual benefit to us and then the service provider. So basically, in the Bawku West district, it has been very effective, not as effective as we really could. I believe that if I were to scale it, maybe about 20% of the generality of the public are aware of it. Its usage really hasn't been that fluid as we would have expected, and it is largely so because of the population that we have. You want to look at whether the people are abreast with the use of smartphones, and are they really what is the penetration of the Ghana card access in the district. We believe these are all of it, but we are not relenting on our efforts. We are always doing the education and treating people to use that and to ease their access to our services. So I've just maybe I've been long, but I just decided to give you a snapshot of exactly what it is that we are doing from our innovative point of view. That's right. So what we are doing is that constantly we are on air. Every day you will hear our live presenter mentions in our jingles playing, and we would want to thank UNICEF, as a worthy partner that supported us to be on air, for the entire 2020, almost the ending part, the last quarter of 2023, and the whole year for 2024. So that has given us even ample time to be able to echo through the jingles and the live presentations. We also go into the studios and then we educate people, we allow for phone-ins, they ask questions. We also organize what we call community dialogues. Now, in those community dialogues, we educate them on other things about health insurance, the benefits, what they stand to gain, drawing their attention to the illegal practices that some recalcitrant health providers are engaging in and how they should watch out, and answering their questions regarding the challenges they encounter in the field, and perhaps they would want us to respond to those. We answer these and we take the time to educate them using live demonstrations how to be able to register one on the MyNHIS app. And that's exactly one of the ways, regardless of the fact that I must admit it is not really that expansive in the district. I think that we are doing all that we can by way of using the radio and also the community levels to echo that particular. The person, I would say the person is losing a lot, and especially if the person doesn't have a health insurance card. In today's world, if you don't have a health insurance card in Ghana, it is a big mistake on your part. And if you have a health insurance card and it is not active, it is a double big problem, because it means that, especially if you are a defaulter in that case, when you become ill or you are taken ill, you use the card, your card at that time, you say, well, I've renewed it, but the card may be active but will not be functional at that time because you'll be serving a probational period of 1 month. So we are encouraging everybody to get renewed and to be active on the service or in the system. Having said that, the MyNHIS app, as I said, has a lot of benefits. Now, you needed to be here in the office to get yourself enrolled. You don't need to be here now. You don't need to come sit with us, queue, and then or travel. You can imagine if somebody is coming from Minaba, coming to Zebeda, I'm told you need to pay 15 cedis on the motorcade and 15 cedis out, so 30 cedis to be able to come and do a service that will cost you. Let's say if you are doing it for somebody who is 15 years and above, let's say it's around 15 years and above, and the person has a Ghana card, that's just 8 cedis. So you are spending 30 cedis to come and solve a 7 cedi an 8 cedi problem. We are cutting all that cost for you. Number two, it is convenient. It is at your own time. You can wake up in the middle of the night and say, hey, Kofi, my son, you are 17, you have a Ghana card, and you are not with health insurance. Let me get you registered onto the health insurance. And that is something that you can seamlessly get your people active or enrolled. Another thing is that it has the features is not just about MyNHIS app. I told you we have the medicine list. So you can challenge the authorities of the health providers. If they are telling you, maybe out of cruel means, they are telling you, this particular medicine is not captured or it's insurance doesn't pay for these medicines, you can say, and if by the grace of God you have the benefit of reading education, you can understand, you can question and say, but I've seen the diclofenac injection as part of the medicines that NHIS is paying, so why should you be charging me money when NHIS has paid? So you can defend and get value for the services they subscribe to with health insurance. So there's a lot. You can also have numbers to district offices across the country. You can have any other publications that we issue out, any innovations we bring. In real time, we are going to have all those updates in the MyNHIS app. And I think that if you are not on the NHIS app, then really you are losing a lot, especially the young people who are very good surfing the internet all the time. You need to spend some time doing some registrations, enrolling your siblings, enrolling your community. And again, for community officers, those who are willing to assemblymen and those who are interested in community service, in your own community, you can just take your phone and your MyNHIS App on your phone. And those who have health insurance and are finding being reluctant to be able to go to the office to get themselves enrolled, you can get them enrolled in that community, because we really want to see everybody in Ghana, the universal health coverage that we are targeting by 2030. We are pushing, and we believe that by that time everybody should have been on the policy. So if you are not on it, say you are missing a lot. Well, there has been, but it has been fluctuating, to be honest. We don't have nominal figures from the district. What we can give you is the coverage of the population that we have. I think we have about 144,000 people per the Ghana Statistical Services data. We have about 144,000 people as of 2020. And that, out of that number, we believe we have covered about 60% of the population that are on the system. But when it comes to the active membership, it is not just being in the system, but we are looking at, is the person active? Should the person encounter any health needs right now? Can the card or our service being with us, will he be able to benefit something? That is when we would have said that your being with us or your enrollment with the health insurance is really is what we actually ascribe to. So we are encouraging people to be able to keep themselves active. We have recovered about 60%. It's an effort. This year, our effort is to be able to up that 60% into about some 70 to 75%. By the end of this year, we are trying to up that by some 15 percentage points. And the target is that by 2030, we should be able to reach that at least. Everybody in the Bawku West District should be able to be covered by the health insurance.